This is the Hake News segment of the Jesse Lee Peterson Show, Hour 1. COVID numbers are overblown. What a surprise. And the shutdown is doing more harm than good, obviously. Remember, Men's Forum, Bond Monthly Men's Forum this Thursday, 7 p.m. at Bond in Los Angeles, guys. For men only, rebuildingtheman.com/events. Rebuildingtheman.com/events. Men's Forum's first Thursday, Women's Forum's third Thursday of the month. End of Hour 1, Tuesday, September 1st, 2020. Stay tuned for Hour 2. It is 5 minutes till 7 a.m. here in Los Angeles. Like I said, the virus numbers are way overblown. Drudge says that the U.S. death toll is currently 183,601. The New American reports that an opinion tracker from late July indicates that people think, in general, people think that 9% of the U.S. population has died from COVID. In reality, it's 0.05% of the U.S. population, and COVID was the sole factor in the deaths of a mere 0.003%, 0.003%. The CDC reports that fewer than 10,000 of Americans have died from COVID-19 alone. The New American reports only 6% of the Americans in the United States who have died with COVID-19 died strictly from the virus and not from other causes, according to new numbers from the Centers for Disease Control and Prevention, the CDC. Their latest COVID-19 provisional counts from February 1st through August 22nd say that 164,280 Americans have suffered deaths involving COVID-19, the Chinese Communist Party virus. That, of course, can mean anything from having had a recent positive COVID-19 test, which may or may not have been accurate, to having been tested positive months earlier, to simply having declared positive based on symptoms, with hospitals facing strong financial incentives to claim COVID-19 deaths. Pretending that their numbers are accurate, the CDC calculates that just 6% of them, or 9,857 on average, were caused solely by COVID-19. 9,857. For deaths with conditions or causes in addition to COVID-19 on average, there were 2.6 additional conditions or causes per death, the agency says. In other words, 94% of those who died with COVID-19 already had two or more other serious health issues, as hypertension or diabetes. On top of that, age was a major contributing factor. 92% of deaths involving COVID-19 occurred among individuals 55 or older. Persons 75 and older accounted for 58% of such deaths. 22% of COVID-19 deaths occurred in nursing homes and long-term care facilities. That number is considerably higher in states that ordered these facilities to accept COVID-19 patients, and would be higher still in New York if the state were honest and had not changed its counting method to disguise the order's deadly results. All right. LouRockwell.com blogger Michael Rosef suspects that if it had not been for COVID-19, otherwise seriously ill or elderly people would still be alive, but several other comorbidities were present, like heart disease or emphysema. And the cure is worse than the disease. Revolver.news has an exclusive study that they have at the top of their page, Revolver.news. COVID-19 lockdowns are over 10 times more deadly than the pandemic itself, they say. They explain it all in a long article talking about the health effects of unemployment and the ridiculous overreaction to the virus. Phony Joe Biden told ABC host John Muir that I would shut it down. I would listen to the scientists to stop the spread of COVID-19. In his first interview alongside his female running mate, Kamala Harris, President Trump's Republican National Convention speech said that the cost of the Biden shutdown would be measured in drug overdoses, depression, alcohol addiction, suicides, heart attacks, economic devastation, job losses, and much more. I'm James Hake.